The map of medicine has gone very well for us. It's given us an opportunity for clinicians and managers to work together, and as Cathy will explain to you, how has it gone forward?
We identified areas we wanted to tackle for the benefits of patients, and working together with our acute sector colleagues and our PCT colleagues to ensure that we were working up to a gold standard of service provision for the patients, but using the maps to help us achieve that goal.
So in practical terms, what has the map done for you?
We have maps for COPD now, we have it for AMD. We have used it to service redesign and to engage the whole health community in tackling some of these problems.
It has helped us to address needs that has been identified in commissioning and in patient care. So it has been like an overarching bridge which has helped to move clinical care and commissioning forward together on the Wirral.
What have you learnt in moving towards implementation of the map in your area, which you can pass on as a tip almost to anyone else who's thinking of adopting it?
I think the most important thing is engagement. It's engagement between managers, clinicians, primary, secondary care and patients. They're very, very important. We have patients in every group. And I think it's this total engagement that gives it the value, and that gives it the power, and it gives it the ownership of the people. And that's why it happens.
Mm-hmm. So you have to get all of your health professionals to sign up to it, presumably, for it to be most effective, Cathy?
Yes, we had an awareness raising event, and from there the modernisation teams we have on the Wirral all signed up. They wanted to use the map, and that's how we rolled it forward.
What do you think is the best way of assessing how successful it's going to be?
I think when we assess patient, we can do it at three levels. One is to look at from the commissioning level as we analyse the productivity matrix and see things change. From the patient level, when we look at the patient satisfaction survey and see how the field services have improved. And from the clinician level, when they actually feel that the quality of service and the care in the community or the pathways have improved. And that's clinician in the primary and secondary care.
So is it a project that takes a short-term pain for a long-term gain kind of thing? It seems to take a lot of work to actually get it to a stage where it can be useful.
Yes, I suppose you could look at it like that, but the long-term gain is to actually address the health needs of the people in the Wirral, and so the short-term pain is well worth it.
I wouldn't say there's any pain. It's like a wonderful tool that one needs to engage to, and it does deliver. So it's a matter of getting in there, getting stuck in and carrying on to make sure it delivers.